The cardiac rehab workout video I have on my channel follows all the protocols for strengthening the heart muscle. But if a 55-minute program is a bit too much, then I have a condensed version for you here today. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I have a gentle cardio workout that will help strengthen your heart. If you're new to this channel, we offer tips, advice and exercises to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. So if you have coronary heart disease, heart valve disease, stable angina, have undergone cardiac rehab following stents, bypass surgery or a heart attack, or even if you have high blood pressure and want a gentle exercise program to improve your cardiovascular health, then this 30-minute workout is for you. Following a steady warm-up, we will have a circuit of 7 exercises that mix cardio and resistance ones. I will then get you to monitor how hard you feel you're working using a pulse check and the RPE scale before completing a second circuit and then finishing with a gentle cool down and some stretches. Please don't follow this if your heart condition was diagnosed or your surgical intervention was within the last 3 months. And if you are unsure if it will be safe for you, it's best to check with your doctor or cardiologist first. I'm also assuming that you know how to self-monitor and check your heart rate and understand what it should be during exercise. If not, then I do recommend you watching last week's video that I did on this topic before starting this one, so you can check that out by clicking the pop-up banner up here. You will only need a space to move around in, a couple of hand weights, and I'm using water bottles for this, and a wall space for the press up. So get yourself ready and let's get started. Right then, let's start this warm up with a gentle walk on the spot, just to get the body moving. Again, we're going to start off really gently for this warm up and then just gradually build the intensity over the next 6 minutes or so. So it's important that we don't start too quick, just start off nice and steady. Okay, so what I want to do from there is we're going to do some heel digs out to the front. So you're going to alternate left and right, trying to pull the foot back towards you as you let the heel dig out to the front. Good. Okay, next one we're going to do is a toe tap to the front. So pointing the foot forwards, tap the toes in front of you. Again, still alternating left and right. Brilliant. We're going to go back to that heel dig, but this time we're going to do it out to the side. So we're taking the foot out to the side and then back to the middle. Lifting the foot back towards you, pulling the toes back so you can dig the heel down. Okay, let's now change that to a toe tap to the side. So pointing the foot forwards again, like we did to the front, but now we're doing it out to the side. Good, and then the last one, we're going to do a toe tap to the back. So pointing the toes again, just let the toes tap behind you before you bring the foot forwards again. Good. Okay, right, let's go back into a walk again. So while we're walking now, we'll make it a little bit more of a march just to build the intensity a little bit. So I want you to lift the knees up just a little bit higher and get a bit more of a swing of your arms as well. So as you're doing that, up nice and tall so you can engage your core muscles. And as we go through this warm up, you're obviously going to start to feel warmer, but you also feel that your breathing should start to increase a little bit as well. Okay, good. Let's just bring it back down to normal walk again, but this time we're going to get the upper body moving a bit with some shoulder shrugs. So I want you to lift both shoulders up towards your ears, squeeze the shoulder blades back together and then let the shoulders drop back down. So we're going to lift, squeeze back and then drop. Lift, squeeze back and then drop. Try and get as much movement as you can on both sides with this one. Make sure we're keeping the feet just gently walking on the spot. Now if you've got the mobility in the shoulders, I want you to add a bit of shoulder joint movement by lifting the elbows up, squeezing them back and then dropping them back down. So we're just generating a little bit more movement now for the shoulders. Really focus on squeezing the shoulder blades back as the elbows go back, so we can activate those postural muscles up on the top of the back. Good. Right, let's go back into a walk again. Okay, so we're going to go into some mobility exercises for the spine next. So bring the feet down to standstill, take the feet out a little bit wider, hands on the side of the legs. We're going to do some side bends where you're just reaching down one side of your leg, come back up to the middle, and then do the same the opposite way. So as you're doing this exercise, be careful that you're not going forwards. So try and keep the hips pushed forwards so your body stays in that alignment as you just lean from left to right. Good, and then come back up to the middle, bring the feet back into a walk. Right, let's do a few knee raises next. So hands out in front to dictate how high you want to lift the knee, and then lift the knee up to tap the hand. Good. So if you're feeling very coordinated, then what you can do is bring the knee up and across to tap the hand on the opposite side. So introduce a bit of a twist to it. Good. And bring it back to a walk again. Okay, let's bring the feet down to standstill and take them out a little bit wider. This time hands in front of the chest, and we're going to rotate the spine as we twist left and right. Good. And then bring it back to the middle, facing the front. Bring the feet back into a walk. Right, a couple more exercises before we finish the warm-up and then start going into the circuit. So I want you to go back to doing the heel digs with the feet. We're going to use the arms as well. So we're going to do a bicep curl action on the arms, keeping the elbows tucked in and bringing the fists up to the shoulders. Good. Okay, next one we're going to do is go into that toe tap that we did out to the side, bringing the feet back together. As we do that, we're going to do an arm raise at the same time. So you can take your arms out to the side or up to the front, whatever you prefer. So keeping both arms relatively straight, just a slight bend in the elbow as you raise them up to shoulder height at the same time as you do the toe tap out to the side. Again, just make sure you're working at a pace that feels right. And then the last one we're going to do is go back to the toe tap to the back. Lift your elbows up behind you. As you do the toe tap to the back, we're going to do this arm extension. So you're straightening the arms out as you do that toe tap behind. Good. Okay, back to walk. Right. Get ready now because we're going to go into the circuit. We're going to start off with some knee raises, a little bit like we did in the warm-up, but we're going to get a bigger movement with your arms. So as you raise the knees up, we're going to take both hands onto the outside of that knee. Ready? Off we go. So knee raises, but we're just bringing these arms up and over. Take them down on the outside of that knee that you're lifting. So with working on the intensity for this one, you can change the intensity in one of two ways. You can do it slower. So if you slow the movement down, that'll make it easier. Obviously, if you go at a faster tempo, that's going to make it more intense. So find a pace that feels right. The other thing is, if you do a smaller movement, then that's going to make it easier. If you go into a bigger movement, that's obviously going to make it harder. So bigger movement, faster movement, higher intensity, smaller movement or slower movement, lower intensity. So just find a pace that feels right for you and a movement. See if you can stick with it. We're doing these cardio exercises for 1.5 minutes. We'll follow that up with a 45-second active recovery exercise, which will then allow your heart rate to come back down a bit. So you should be feeling breathless on these cardio ones. Keep that movement going. Keep the oxygen going in, so you should be hearing yourself breathe. Body needs the oxygen to keep working. Good. Okay, we got just coming up to just over 10 seconds to go. So keep that movement going. Good. Okay, stop there. You need your hand weights for the next one, for the active recovery. So I've got my water bottles. We're going to do an upright row. So you want the hands down in front of you with your weights, and then you're going to lift the weights up to the chest, elbows to the side, and then back down. Off you go. So as we do this one, we're going to keep the feet marching on the spot, just to make sure that the blood keeps moving around the body and allows the blood to come back to the heart. So a bit slower movement on this one. Because it's an active recovery, you might find that your breathing will start to get a little bit easier by the time we've finished the 45 seconds. So just make sure that you're lifting the elbows up to shoulder height. Your weight should only come up to about level with the chest before you then drop them back down to make your arms straight. So keep the weights close to the body and just make sure you keep the feet moving gently on the spot. Last couple of seconds. Good. Right, pop your weights to one side. The next one we're going to do is a hamstring curl. So this is where we're moving from side to side, flicking the heel up to the bottom. As we do that, we're going to take the arms back behind you as you do the hamstring curl. Off we go. Good. So squeeze those shoulder blades back together as you're taking the arms back behind you. So remember, bigger movement. If you move more, it's going to make it more intense. If you do it at a faster pace, that's going to make it more intense. So find a speed and a range of movement that feels right for you, because you need to be able to sustain this for 1.5 minutes. And make sure you keep breathing, keep the oxygen going in. Good. Okay, so we're on the second cardio one of the 4 within the circuit. So by now, if I show you that rate of perceived exertion scale of 0 to 10, you should be feeling around about a 4, 5 or 6. Okay, if you're not quite there yet, you can just try and sustain it to see if it's still coming up. If you've gone beyond it, then you need to slow yourself down. So if you're a 7 or higher, slow the movement down or make it a smaller movement to reduce the intensity. Good. Keep that movement going if you can. Keep the oxygen going in. Got 10 seconds left on this one, and our active recovery is going to be a wall press. Well done. Okay, so now we're going to need your wall space, because we're going to do the wall press. So you want to be about an arm's length away from the wall, hands a bit wider and a bit lower than shoulder height, and then just allow the body to go in towards the wall before you push yourself away. Ready? Off we go. So again, slow, steady movement. Now to make sure we keep the feet moving a little bit, what we can add in is a little bit of a heel raise after you've done the wall press. So that will just allow the muscles in the lower part of the back of the leg to make sure that they're still promoting the blood flow back to the heart. So as soon as you've got your arms out straight and you've pressed, just lift the heels up off the floor a little bit and then drop them back down before you go back into your press up. Again, 45 seconds on this one. Last few seconds. Just keep that movement going. Again, it doesn't have to be at a fast pace, this one. Good, well done. Right then, the next one we're going to do is a half star. So for this one, what we're going to do is we're going to be doing a toe tap out to the side at the same time as both arms go out to the side. Okay, get yourself ready. And off we go. Good. So arms only need to go up to shoulder height. If you do have shoulder problems, what you might find easier is rather than taking the arms out to the side, just do it on a bit of a 45-degree angle. That'll make it slightly easier on the shoulder joint. Also, if you do it with the thumbs pointing up, that'll just make sure that your shoulder's externally rotated, which will make it a little bit easier. So again, it's just making sure you've got the pace that you can sustain for 1.5 minutes. So if you need to slow it down a little bit, slow it down. If you need to reduce the range of movement, reduce the range of movement to make it easier. You might feel this in the shoulders a bit. Good. How are you feeling? Hopefully you're still around about a 4, 5 or 6 on that 0 to 10 scale of how puffed out you're feeling. Good, keep that going if you can. just got 15 seconds to go. Last couple of seconds. Well done. Good. Right, grab your hand weights again. So this time we're going to do some bicep curls. So this is where we want your elbows tucked into your waist. We're going to bring the fists up to the shoulders, bending the elbows, drop down, arms straight. Ready? Off we go. Again, like we did the upright row, we're going to keep the feet moving. So we're just going to do a gentle march on the spot while you do these slow bicep curls. So think about your posture as you're doing this. Keep the shoulders down and back. Keep the elbows back. So we're not bringing the elbows forwards. Keep the elbows back as you lift the weights up towards the shoulders, bending the elbow, and then back down to your arms are straight. So slow and steady. You're starting to feel you're getting a bit of recovery. And we've just got one more exercise to do, one more cardio exercise to finish the first circuit. And that's when we'll do a pulse check after that. Good. Okay, just pop the weights down to one side for a second. So the last exercise in the circuit then is we're going to be doing some step backs with a front raise. So as we do a step back, allow the back foot to be on the toes. Bend this front knee a little bit as your arms come up to the front. Off we go. So the bigger the movement, if you get a big step back and more of a lunge, like a step back lunge, that's obviously going to make it harder. You can make it shallower by just doing almost like a toe tap to the back and reducing the amount of movement with the arms. So arms are coming up to the front, but we're making that step back. Allow that front knee to bend as you step back. So this front knee bends at the same time as you do the step back. Good. So again, because it's a cardio one, heart rate's going to be coming back up again. When you put arms and legs together, big movements, more muscles work, so the heart rate's going to have to work a bit harder, which is what we want, as long as it's at the right level. Okay, we've got less than 30 seconds on this last exercise in this first circuit. So after this one, we're going to do a pulse check. So if you've got a pulse monitor or a smartwatch, you can obviously use that to check that you're working at the right level. Otherwise, you can do what I'm doing, which is just going to be taking the pulse manually for about 30 seconds to get my pulse. Good. Last 5 seconds. Well done. Okay, just keep the feet moving while you do a pulse check. Okay, right, I don't know about you, but mine was 152, so it's certainly up there. How's yours? Is it at the right level? That will then dictate how you do the second circuit, whether you need to reduce the intensity or whether you need to increase intensity or whether it's about right. Make sure you use this time to grab yourself a drink as well. But just keep the feet moving, even if you're just walking around a little bit, just keep the legs moving so the blood doesn't start to stagnate in your legs. We've got 20 seconds before we restart the circuit, which is where we're going to start off with those knee raises that we did, bringing the arms to the outside. So we've got 10 seconds. So get yourself ready. Should have recovered a little bit. 3, 2, 1, off we go. So back into it then. We're going to go through each one of those 7 exercises again. But hopefully from the first circuit, you know what sort of intensity to work at now. You should be able to judge that accordingly based on your heart rate and how puffed out you're feeling on that 0 to 10 scale to know whether you need to keep it about the same level or whether you need to reduce it a bit or increase it a bit, as long as the outcome's about right for you. So keep the oxygen going in. Plenty of breathing should be going on so we can work aerobically. Good, just gone past the halfway mark on this first one. Okay, last 30 seconds. Brilliant. Doing good, just keep it going if you can. Last 20 seconds. Good. Are you still with me? Keep it going all the way to the end. Last couple of seconds. Well done. Right, grab your hand weights for the upright row. So remember, we want to keep the feet moving on these active recovery exercises. We're going to lift the weights up to the chest and then back down. Ready? Off we go. So nice, slow and steady movement with the arms. So you control the weight. Elbows just up to shoulder height. Your weight only needs to come up as high as the chest. And you're keeping your weights about the same width as your shoulders. Just keep the feet marching on the spot. So you should actually feel on these active recovery exercises that your breathing is actually recovering a little bit. So by the time we finish the 45 seconds, you should be feeling ready then for the next cardio one. Okay, we've got 10 seconds to go on this one. Good, well done. Right, pop the weights to one side. Okay, so the next cardio one that we did was this hamstring curl, moving from side to side, flicking the heel of the foot up to the bottom as you take your arms back behind you. Ready? Off we go. Good. So same as what I said on the first circuit, the more you move or the faster you move, the more intense it's going to feel. The slower you move or the less you move, the easier it's going to feel. So just as long as you're working at that right level for you, everyone's going to be different. Make sure we're squeezing those shoulder blades together as your arms are going back. So try and lift the arms up behind you, but keeping them straight. Good. Keep the oxygen going in. Can you hear yourself breathe? Because you want to make sure we're getting the oxygen in. It's also important to get the carbon dioxide out as well. So just as important to breathe in is to make sure you're breathing out. So you want to expel that carbon dioxide out of the body. Good. Last 15 seconds. It's almost done on this one. Last 5 seconds. Well done. Okay, let's go into our wall space for the wall press. So make sure you set yourself up correctly. So you're a bit more than arm's distance away from the wall. Hands a bit lower and a bit wider than your shoulders. Feet are shoulder width wide. Ready? Off you go. So remember, as you push out, just to keep the lower body moving a bit, we're just going to do those heel raises just to make sure we're still stimulating the muscles of the lower leg. So as soon as you've pushed your arms out straight, lift the heels up and down, and then do your wall press again. Good. Slow and steady movement on this wall press. You'll feel the muscles on the back of the arms and across the chest and the front of the shoulders. That's what's working. Make sure the elbows are a little bit lower than shoulder height as you bend them. Good, well done. Right then, get yourself ready for the next one. So the next one is the half star. So that's the toe tap to the side with the arm raise. Whether you're doing it right out to the side or on a bit of an angle, depending on your shoulders. Ready? Off we go. Good. So again, just find that pace that feels right for you. Try and sustain it then for that 1.5 minute, 90-second period. If you're starting to fatigue a little bit now, because we are sort of halfway through this second circuit, you can afford to slow it down a bit if you need to, as long as you're managing the intensity right for you. Good. This one always gets me in the shoulders. Feeling that in the shoulders already. Hopefully you are as well, a little bit as well. So keep that movement going. "30 seconds left on this one. Good. Almost done, almost there. Keep that movement going. Last 10 seconds. We've just got the 2 exercises left to finish off. Well done. Right, grab your hand weights then for the last time. So we're going to do those bicep curls, keeping the elbows tucked in, bringing the fists up to the shoulders. Remember, just to keep the feet moving, we'll just do a gentle march on the spot. Off we go. So slow, controlled movement with your weights. Keep the elbows fixed in the position close to the waist as you're bringing the fists up towards the shoulders, and then slowly lower back down. Good. So you should be feeling that recovery on your breathing, which also means your heart rate's recovering as well. So that's the purpose of putting in these slower tempo exercises to work the arms, to give you a bit of recovery for the heart. We've just got 1 exercise left on the cardio. Brilliant. Okay, just pop the weights to one side. Right, so the last exercise that we did then was this step back, making sure that the front knee bends, raising the arms up to the front, and then doing the opposite side. Ready? Off we go. So make sure you're allowing both knees to bend. As you do that step back, this front knee should be bending a little bit. So it's kind of like doing a lunge, but we're not taking that back knee down towards the floor. Good. Make sure you maintain that tempo, whatever it is. This is the last one. And then as soon as we finish this one, we're going to go straight into a cool down where it should feel a little bit easier. And then we'll finish off with some stretches at the end. Good. Halfway through this last one. Just 30 seconds to go. So see if you can maintain that pace all the way to the end. Finish strong. Good. Last 10 seconds then, this is it. Last little bit. Well done, brilliant. Right then, let's go into a cool down. So just keep the feet moving with a gentle walk on the spot. Start to feel your breathing come back down, getting it back to normal again as you recover through this cool down. So just a gentle walk on the spot for a bit. So we're doing this cool down for about 5 to 6 minutes, just to allow the heart rate to gradually recover. Certainly if you've done any cardiac rehab program in the past, this is an important part of it, the cool down. You don't want to just stop straight away, as that's what causes heart arrhythmias. So make sure that we just gradually then begin to reduce the intensity of your exercise. So keeping the body moving so it can come down gradually. Okay, from there then what we're going to do is do a side step touch. So I just want you to move from left to right, tapping one foot to the other foot. And if you want to incorporate a little bit of balance work into this, all you do is you move from one foot to the other foot, but without tapping the other foot towards that one. So we're keeping that foot up off the floor, and that'll challenge your balance a little bit as you move from side to side. Good. Brilliant. Let's go back into a walk again. So just start to slow the tempo a little bit of your walk. So we're not walking quite so quickly. Just start to slow it down a bit. So you should be feeling your heart rate recovering and your breathing's recovering to get you back to a normal state. Okay, good. Right, gradually bring those feet down to a standstill. Have your feet about shoulder width wide. Place the hands on the hips. We're going to keep the hips moving by just gently moving them from left to right. So your head is staying relatively still, and it's just the hips that are moving from side to side. Good. Right, we're going to make circles with those hips now. So we're going to circle the hips round in one direction. So going from the side to the front to the opposite side to the back. Good, and then we'll change the rotation, so just rotate the opposite way round. Good, okay, bring them back to the middle. So what we're going to do now is we're going to do a pelvic twist. So as we turn the hips to face one way, allow the back foot to come up onto the toes. Drop that foot down, and then we'll twist the other way, allowing the opposite foot to come up onto the toes. While you're doing this, just relax your arms. Let them just swing around the body so they're completely relaxed as you twist from one side to the other side. So you should be starting to feel a little bit more relaxed now. Breathing should be almost back to normal. Good. And then bring it back to face the front. Well done. Right then, let's do a few stretches to finish off. So have your feet about shoulder width wide. Place one hand on top of the other. From there, you're going to roll the shoulders forwards and then push your arms out in front of you. As you stretch the arms out, you should feel a stretch around the sides and on the top of the back. So we're going to hold that stretch position, dead still, and just try and relax your breathing now. So slow, deep breaths, just to circulate the oxygen back around the body, and release. We're going to do a chest stretch next. So I want you to place the hands into the lower part of your back, and then you're going to squeeze the shoulder blades back together, like you're trying to pull your elbows back, so you can feel it stretch across the front. Again, slow, gentle breathing while you hold that position of the stretch. Good, and release. The next one we're going to do is a back of the arm stretch. So this is where we're going to bring a hand up to the shoulder, allowing the elbow to bend, and then start to lift the elbow up and back. Assist with your other hand if you feel that you need to, so you can create a stretch here on the back of your arm. Good, and release. Let's switch over, same on the other side. So hand to shoulder, lift the elbow up and back. Good, and release. Right, we're going to do an inner thigh stretch next. So take the feet out a little bit wider, and then from there we want you to bend one knee of one leg just a little bit, but then lean towards your straight leg. So as you slide your hand down your straight leg, that will increase the stretch on that inner thigh. Good, come back up, switch over. So bend the opposite knee just a little bit, Hand on the straight leg, slide it down till you feel that stretch. Okay, come back up, bring the feet back in. So now we're going to do a stretch for the back of the leg. Put one foot a short distance in front of the other. Keep the front leg straight at the knee, hands on the back leg. Push your bottom backwards as your body goes forwards, and then lift the toes of the front foot back towards you. So you should feel stretch all the way down the back of that straight leg. And then switch over, same on the other side. Good. Okay, and the last stretch we're going to do is the front thigh stretch. You might need to hold on to something for balance purposes for this one, but grab hold of one foot, so we're trying to get the heel of the foot up towards your bottom, and then bring that knee backwards, standing up straight, so you can feel the stretch on the front of the thigh. And release, and then spin around, same on the other side. Great, good work everybody, well done. I hope you feel better now after that workout. If you enjoyed it, be sure to give it a like by clicking the thumbs up button below. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel, or click here to watch a recent video. See you soon.